Okay, we'll be performing a sinus exam today. So first thing, I want to go over here, select what we're doing on the computer here. We'll start out with a sinus lateral, do a sinus Caldwell, and then 2 sinus waters here. Start study. Alright, now we'll come over and we'll set up the room. Have our patient sitting over in this chair right here in front of the Bucky. Wait. Go to about 40 inches there. Set up for a 8x12 is what we're going to be using for all of our images here. Alrighty, looks good. Alright, and last step, we want to make sure that the Bucky is nice and clean for our patient. Here is a lot of germs and stuff could be on there from people coughing and all that sort of thing. So we'll give it a good wipe down. No one wants to put their face on a dirty Bucky like this. Alright. Let the air off a bit while we bring in our patient in here and everything. We'll be ready to go. Alrighty, Mr. Scolati, can you give me your birthday, please?
June 8th, 1980?
Alright, is there any chance of pregnancy?
No.
Okay, what's been going on here?
I've been having a sinus infection, supposedly, for a week now. It's very painful, so I've been coughing up a lot of blood, or a lot of mucus and all that. And it's been green, too, the green mucus. And
That doesn't sound fun. Alright, well, hopefully we can figure out what's going on here. We'll start by putting some lead on you here. Wrap that around you so you're nice and protected there. Alrighty, have you sit down in the chair. Load up our Bucky here. We're going to be doing an 8x10 for all of our images. Alright, there we go. We'll have you set up here for a lateral for our first view. Move you on up. Good lateral here. Rather have their head straight rather than them trying to bend it over to touch the board. Don't want to cause a rotation from that. Alright, so first is our lateral here. We want our CR to be directed about 1 inch posterior to the outer canthus. Alright, move that tube up a little bit. Bucky is lined up there. Alright, we'll take our first image. It'll be about 70 at 8 for a lateral view, a bit less than all of our other views. So hold your breath, click, take that first image, take out the IR, run it, do our second one here, which is the water, sorry, the Caldwell. So have you turn and face the board here for this one. Move up as close as you can up on there. You're gonna have your nose and your forehead pressed up against the board. 15-degree caudal angle here. Have that directed to come out their nasion. Right about there. This is a Caldwell view. Get our marker on here. Right side. Alrighty. Have you hold your breath. Click. Shoot that one a little bit higher than the rest, about 75 at 12. Since we're doing a PA view, there's more that we're going through. Alright. Our next here will be a parietal acanthial waters view. So have you raise your chin up basically as high as you can. Want the IOML to have a 37-degree angle with the IR, and the mental meatal line to basically be horizontal if you can. So that right there. Have our tube be horizontal for this one. Directed to exit the canthion right there. You can culminate out nicely, you don't need everything. Alright, got a marker on there. CR in there. Alright, so same thing, about 75 at 12. Hold your breath, sir. Click. Alright, for our final view, we'll be doing a Pyrie open mouth waters method. So you open up your mouth. Alright, and do the same exact thing. IOML is 37 degrees. Have the mental meatal line about horizontal if you can. Same CR point, exiting the canthine. We're just going to have the mouth open so we can visualize the sphenoid sinus right there. And about the same setting, 75 at 12. Hold your breath. Click. There we go. You're all set there, sir. Good to go. All right, hope you have a good day and then figure out what's going on there. All right, Mr. Scolati, can you give me your birthday, please?
June 8th, 1988.
Alrighty, and what's been going on here?
I've been having pain on my right side of my jaw, and it's because I've been wrestling with a bear.
What the berries say, really?
Yeah.
Okay. Well, we'll have you put on some lead here. Let's take our images. Let's see. There we go. Nice and tight. So I have you sitting in the chair here. Alright, so for our first view, we'll do a PA axial. Have our cassette in here, 8x10 portrait. Alright, have you facing the forward here for this first one. You're gonna have the nose and the chin, or sorry, the nose and the forehead touching right there. There we go. Gonna put a 25-degree caudal angle on the tube. There. Have it exiting the canthion right there. And work that down a bit. There we go. Get our marker on there. Alright, so I'll be shooting about 75 at 12 for our view here. Have you hold your breath, sir. Click. Alright, breathe. Next, I'm going to have you raise up your chin, so your chin and your nose touch right there. Going to increase our angle a bit to about 30 degrees. Up. For this one, we'll be visualizing the body of the mandible. This time, have our CR exit right about the lips there. Alright. Our marker in place. Got that IR in there. Alright, we'll be shooting about the same thing, 75 at 12. Alright, hold your breath, sir. Click. Alright. Next one, we're going to be doing an axial lateral view here. So have you turn face. You're going to do like a lateral here, so I want them to be in a true lateral. Going to have about a 25-degree caudal angle on that. Going to center at the ramus. Have you scoot up a little bit right there. There you go. That's good. All right, doing the right side here for this image. All right, and once again, we want to drop, since it's a lateral, we want to drop down the technique a little bit. We'll do about 70 at 8 for this view here. There we go. All right, hold your breath, sir, and click. All right. For our last view here, we're going to do a SMV, a submental vertical view. I'm going to have you turn and face me here. I'm going to scoot forward a little bit in the chair. All right, and then you're going to move your head back as far as you can. Your neck. Go in there. So we want the ILML parallel with IR if possible for this one. If you're able to achieve that, you'll just have a horizontal tube angle here, right about the midway between the mandible. Let's see. Just need to move the bucky down here. One sec. That's the view. All right, perfect. Get our marker up on there. Right side. All right, and for this, we're going to up the technique a little bit more, so maybe 75 to 14 or so, going through a bit more tissue this time. All right, sir, hold your breath. Click. All right, and you're all set. That's it. You're done today.
Okay.
Hopefully, we'll figure out what's going on and see if those bears will keep you down.
Okay.
All right. Have a good day.
You too.
All right, we'll go over the images that we would have taken for our sinus series right here. First would be the lateral sinuses, which allows you to see all four in profile there, beginning with the frontal, ethmoid, sphenoid behind it there, and the maxillary. In the true lateral, you should be able to see the sella turcica as well right there, and the orbital roofs should be superimposed. Next we have our PA axial Caldwell view right here, looking at the image. We're looking primarily at the frontal sinuses right there, but you can also make out the ethmoid and the maxillary. The sphenoid is somewhat visible in the center right there, but is pretty hard to see. Next we have the parieto-acanthial waters view here. For this one, we're looking primarily at the maxillary sinuses, although you can make out the frontal and the ethmoid a little bit right there as well. But primarily, we're looking at the maxillary right there, with the petrous ridges should be below them to make sure that they're not superimposed and can be seen whether they're clear or not, such as in this image right here. Finally, we have the open mouth pyrie view of the Waters method, which looks similar, but with the mouth open, you now get a very clear view of the sphenoidal sinuses right there, with a nearly tangential view of the maxillary up above as well. Alright, now I'll take a look at the images that we did for the mandible, beginning with the PA axial projection of the rami. You can see right here that the rami are nice and elongated, which makes it easier to visualize any sort of displacement or fractures right there. You can also make out the body a bit, but there is some loss to superimposition right there. Next we have our PA axial projection for the body. You can see the image right here. Now the body is a bit more elongated. With the other structures are visible, but the body here is most clear and can be most easily seen, as well as the TMJs up top. Next we have the axial lateral projection, in this case for the rami. When I have the side closer to the IR is going to be thrown downwards from the tube angle. Other side up right there shouldn't be overlapping with the bottom. You should be able to see the rami right there up to the TMJ. Finally, we have our SMV, or submentovertical projection here of the mandible. Should be able to make out the body and the condyles right there on the sides.